Let's talk about total parenteral nutrition, or the TPN. So what are the roots, indications, complications, and what are the monitoring parameters that you have to look for in a patient taking total parenteral nutrition? So the roots, first of all, they are mainly used as central route because you are often giving hyperosmolar solution, but you can also use a peripherally inserted central catheter where you insert a long catheter around 50 to 60 centimeters in length that comes up to your central vein, but you insert it in a peripheral vein. So those are the two ways of giving the TPN. When do you use TPN, or what are the indications? First of all, you use them in patients who are malnourished, and who are unable to take feed through oral route due to some reasons, maybe some GI reasons, maybe some GI disease, or maybe they have multiple organ failure, or maybe they are going to have a surgery. So any malnourished patient who are going to have a surgery, you have to give TPN. Or any patient who has multi-organ failure, who is unable to feed orally because probably his consciousness level does not allow him, or he has some bowel disease, then you have to use a TPN, or total parenteral nutrition. So malnourished patient unable to consume enough for a prolonged period of time. What are the complications? So you have different types of complications. Some complications are related with the catheter, and some complications are metabolic. So those are the catheter related complications, such as pneumothorax. When you first introduce the catheter, it can lead to pneumothorax. Or if the catheter is not properly maintained, it can lead to local or systemic sepsis. It can also lead to catheter thrombosis. There are some metabolic complications, and the metabolic complications are refeeding syndrome, where you will have the classic electrolyte abnormalities such as hypocalcemia, hypomagnesemia, and hypophosphatemia. And you will also have hyperglycemia, because oftentimes the patient's solution contains a lot of glucose, and there can be a fluid overload. If you are not keeping the fluid chart well, then the patient can develop a fluid overload. And in prolonged TPN, there can be hepatic steatosis, or even the patient can develop cirrhosis in the long term. So what are the monitoring parameters? What you have to look for? First of all, you have to regularly do an electrolytes, which contains the sodium, potassium, and magnesium. You have to do them daily until the patient is stable. Same for calcium and phosphate. You have to do them regularly. You have to do the liver function test, because you see that there are some liver complications such as steatosis. So you have to do the bilirubin, ALT, STLP, and gamma GT. Check the inflammatory markers such as CRP, ESR, and leukocytes. Obviously, check the glucose, because there is a chance of hyperglycemia, and there is a chance of hyperlipidemia also. So check for cholesterol and TGs.